Health Department has made a U-turn on pupils not having to wear face masks in classrooms. There's much confusion when a statement on new COVID-19 health regulations published last night exempted pupils from wearing masks. The department blamed this on human error, urging pupils to continue wearing their masks. That's when they're indoors. Well, let's get the latest in as far as these regulations are concerned. We're joined by Dr. Nicholas Crisp, who's also the Deputy Director General in the National Department of Health. Dr. Crisp, good evening to you. Thank you so much for your time. Lots of confusion today about the status of the mask mandate, especially for school learners. How did all of this happen? Have you been able to find out?
Yeah, good evening, and thanks very much for the opportunity to speak to viewers. It's just in the hustle and bustle of trying to rush to get things finished and not editing press statements properly. I must apologize for the confusion that's created. What is supposed to happen is that on schools, children do not need to wear a mask outside of the classroom. But in the classroom and in indoors venues, we are still expecting children, and all the staff in the school to wear masks.
Of course, you know, there are those that are looking from the outside, looking in and saying some of these mistakes, like the one we're talking about now, wouldn't happen if things weren't as rushed as they are.
Yeah, well, that's true. We've got a very small team, and if we all had a bit more sleep, I'm sure we'd make fewer mistakes. And also, it's the first time round with many of the things that we are doing. So, we do make mistakes, and all we do is, I can only apologize for the part that I played in reinforcing that this morning when I was reading from our own press statement. People would have seen I even looked confused myself because that's not what I had read in the actual regulation. But anyway, now we do want to rectify it. We would like to play it cautious. We would like children to be protected in indoor venues like we would others. We would like to make sure that people vaccinate so that they get as much immune response as they possibly can. Because quite frankly, we don't know what's still coming with this COVID. And we must expect the worst and we must be responsible. We're not trying to force people to do things. I think we are long past that. We are trying to ask the public to take personal responsibility as far as is possible. It's not a criminal offense anymore to do these, to not wear a mask. But it is a responsible thing to do. Mask up, wash your hands, do the things we've been asking you to do, and get vaccinated if you're over 12 years of age.
Dr. Crisp, also today we had the Minister talking about the extension, this is for public submissions to the draft regulations, that has been extended, I think, for the next 3 months, following a lot of back and forth about whether or not the department would have time to go through the submissions that have been made by members of the public and different organizations. There are concerns that the department hasn't been very organized, Dr. Crisp.
Yeah, Kathy, we are actually quite organized. You'll be quite surprised, but there are lots of naysayers. The vaccination program has been attacked, I'm sure you're aware. There are different people who have different views. This week we got a threat of legal action if we don't vaccinate under 12. And we've just finished a court case where we were taken to court because we are vaccinating people under the age of 18 and over the age of 12. We have people who threaten all kinds of things on the left and right of the spectrum. So, to deal with a broad church of people where there's lots of information in the public domain, people who have absolutely no idea what they're talking about are weighing in on quite complicated scientific discussions. We have scientists themselves disagreeing on public platforms about various approaches. We are looking at international, and we compare ourselves to a country who's got a 90% vaccination rate, and we want to have the same behavioral standards as are required there. It's a difficult space to navigate. So we received over 300,000 inputs. The bulk of them appear to have been computer generated or just sent off, so that they are not particularly useful in terms of contributing to the discussion. But some of the comments are extremely well thought through and very important for us to take seriously. So the minister said to us all he would like to extend the period for that portion of the regulations. We have a large team that's busy sifting through to exclude, just the small things where people are either outright rude or swearing at us or are not really contributing at all, just sending blank emails. But for those that are serious, they are being sifted and taken very seriously.
As we speak, one of the stories that we have on our screen right now is just, close on 10,000 people, if we round that figure off. But to be specific, it's 9,700 people that have now tested positive for COVID-19. Those numbers, how concerning are they to you?
Yeah, so today was 9,757 and yesterday 6,170. The other days before that, with all the public holidays, are extremely difficult to interpret because they were 3,000 and something and 4,000 and something. So these are the results of laboratory tests that are reported into the system. Of course, there are a lot of other people who get COVID who don't even go for a test and we won't know about them. But this is the marker, and what's also concerning is 26% of all tests that are taken are positive. It's a different ratio in the public and the private sector because of access to laboratories, I guess. But what this does tell us is that there is still quite a lot of COVID circulating in the community. People are still getting sick. It is Omicron. It is largely now the BA.4 and the BA.5, first in Gauteng and the second in KwaZulu-Natal. But all provinces are now experiencing increases in their case numbers. So it's not what we saw during the Omicron or the Delta waves, but it's still enough for us to know that we should be cautious and we should be protecting ourselves. And we hear people saying you don't need to vaccinate because there's a lot of antibodies circulating in the community. We do not agree with that, and most of our scientific advisors would not agree with that. The more times you are vaccinated within the provided schedules, the better your immunity, and you get cellular immunity, which is a much more long-lasting immunity. So it's not enough to say that there are people with antibodies in the community and therefore they're not going to spread the virus. We know that it is not the case and the virus is spreading. So the message is, please be cautious, wear a mask where you can, avoid large gatherings, try not to be in environments where you're at risk, especially if you have other illnesses or if you know you are immunocompromised. And please get vaccinated. The services are available.
Dr. Nicholas Crisp, let's leave it there for tonight.